The World Professional Association for Transgender Health has established, based on peer review and expert studies, standards of care for the health of transgender and gender diverse people. In the current version 8, the standards include comprehensive health care beyond hormonal or surgical treatments. Yet this is where coverage in Nova Scotia is stuck. The Minister has been reviewing the Standards of Care version 8 since September 2022, but there is still medical care that Nova Scotians can't get. Will the Minister stand and commit to delivering comprehensive transgender health care?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. And certainly, I am proud of the work that's happened in Department of Health and with the advocacy of a number of community members to support the expansion of gender-affirming care. I recently did meet with a number of advocates to be able to talk about, what are some of the procedures that we don't cover that are included in the WPATH guidelines. So we are looking at those. I know that there are a number. We're looking at what is happening jurisdictionally, whether other provinces are covering these treatments, etc. So there are discussions underway. I will say there's a number of things that come through the department. As members know, there's an infinite number of requests for finite resources, and we really are trying to improve access to health care across all genders and all age groups, but we will continue to work with community to understand how we can support.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Madam Speaker, earlier this winter, the North End Community Health Care Centre was planning to host a session on gender-affirming care at the Glitterbean Cafe. Unfortunately, the event had to be cancelled because groups were planning to protest outside, and I'll table that. All Nova Scotians deserve a safe place to discuss their health care. What will the Minister do in the coming year to expand gender-affirming care and support better education so that people can safely discuss their health care needs?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. Thank you. So certainly we want people to feel safe and be able to ask questions and get the information that they require. We want folks to not only have community or conversations in healthcare facilities, but we want people to feel free and welcome to have those conversations in places like libraries and community resources, particularly in rural Nova Scotia where it's more difficult sometimes for people to access information. So perhaps online would be better. So we're open to those conversations. We work with folks, sexual health world that are providing services, and we're open to any ideas that are available in order for us to help support people who are looking for gender-affirming care information.